Namaskar, viewers. In today's health quotient, once again in neurology, but I myself personally is mesmerized to see the profile and the achievers tag of this particular doctor. Today I have Dr. Bindu Menon with me. Most welcome to the program, doctor.
Namaste. Thank you for having me here. Okay.
Dr. Bindu Menon is a neurologist, and with all the other anecdotes and appreciations in her feather, she is doing a very wonderful philanthropic job. She is going to the rural India intentionally and spreading the awareness about the neural related disorders and diseases that people come across. And she and her team, of course, together are doing a marvelous job of not only educating but treating the people who cannot reach to the hospital. So all that we'll talk to her today, and of course, what it means to women, because that is mostly the ignored part. So that is what we will discuss with doctor. Doctor, now first come first. You are not coming from a doctor's family background as such, but generally when the woman thinks of getting into the medicine field, her first choice is always gynecology. So, what made you to get into neurology?
Well, getting into neurology is a little further thought,
Yes.
Getting into medicine is one thought.
Mm.
Getting and helping medically people was the beginning of thought. And I would say that quite early in my life, there was a hidden thing that I should help people. And I think that comes from the family, your parents, you see them doing small things, may not be in a great way, but then doing small things in a small way, and then there you learn. And then I was engaged with the HelpAge India as a small student from the school, where I used to knock at doors and get money for the elderly people who are staying in old age homes. And from there we used to visit from the school one or two small establishments where we felt that the medical aid was not there. And then there was a calling that, yes, I should become a doctor. Gynecologist per se was not the first choice, because as you said rightly, and now actually it's all changed, every field is for everybody.
You have,
Yes, irrespective of gender. Medicine was something which always intrigued me, because I felt that it is fulfilling, it is complete, it is from top to bottom. And then brain has always been a puzzle to me. And to solve that puzzle, you have to be someone who is more capable of understanding neurology. And I suppose that's how you get to learn and you get to go into that field.
So, doctor, it's been what, more than 20 years in this field now?
Yes.
So almost a decade.
Yes.
Now, very basic question. The intention that you joined medicine with, do you think after 20 years have you achieved that?
Absolutely. I have no doubt about it. If I have given another an alternate chance, probably ऐसे अपन बोलते हैं ना, जन्म जन्म तक हमने क्या करना है, I would always want to be a doctor at any point of time. And I personally feel it has been fulfilling from day one. And that day one I am saying, Ketaki, is when I joined as a student.
Yes.
And while we were still registrars, and we were not in consultants, we were not yet taking decisions.
True.
But then you could see your teachers moving into the patient's bedside, counseling them, seeing the recovery of the patient. But then everything is not always beautiful, There are patients on the other side where we know there are certain diseases which we cannot do, which it could have been done better if they had reached the hospital earlier. Sometimes the diseases per se are not much that we can tackle. You have seen both coins, but then we have given them the courage, we have given them the how to deal with problems also. Yes, it's not that always you get to cure. It's always how you can deal with that particular situation, and over a period of time you can reach up to a level where it is almost capable to attain activity on his or her own,
making them independent.
Yes, absolutely. Yes, Ketki. Yes.
So, doctor, you have a very amazing and very impressive work that is called Neurology on Wheels. So, what pushed you to into that? It's very essential. Let me tell you, that is what has impressed me as well. So, I really want to know
Yes.
why and how.
So, Ketki, in our country, there is a large divide between the urban and the rural. We all of us understand that, let us say that according to the Indian standards, roughly one doctor should be catering to 3,500 people. And if let us say that if any neurologist or any specialist, they are all in the urban areas only. There is the specialist, and there are doctors now who are posted in PSC, but then they are completely with work, because the huge workload they are. It's difficult for them to manage as well. So neurologists and super specialists are absolutely not there in the rural areas. And as far as I'm concerned, as a neurologist, if let me say that brain is a very delicate structure, any damage that happens to the brain can be irreversible if it is not dealt in time. So what I saw is that when I started my foundation in 2013, Ketiki, I used to do the camps at a place for the underprivileged, but then that was again in the urban area. So people who could reach me. So a couple of people used to ask that I have a XYZ relative who is in the village and they're having this problem, they're having this problem. So in part of conversation, I personally got the feel that there are so many people whom we can address to see that they do not get the disease. We can address to see that this disease does not lead to another disease. So that sort of prevention we are talking about is primordial and primary prevention. Primordial is not getting hypertension and diabetes. Secondly, if you have a hypertension and diabetes, not getting a brain stroke and a heart attack. So you can do it in a stepwise manner. So why not move into the villages? So if you move into the villages, where would I see the patient? Where would I ask them? Then I have to cater to those people. I'll ask them to arrange for a place for me. Then I have to have a secluded place where I can talk to them. I can examine them. And I thought that why don't I make a bus? Small thing, a small bus, make some changes in it, have a couch, have a X-ray view, have a sitting place, and neurology needs just a wand, this is the one, and you need an ophthalmoscope, and you need history from the patient to know. And a couple of them do have investigations also, so I can get everything done. If they have this X-ray machine to see, view box to see that. So we have a motto is we reach, we teach, we treat. So we reach from the urban area into the rural areas. So we reach you. You don't need to travel to us. We teach means we have the whole village coming to see that what's happening. A doctor has come, irrespective of neurology. So the relatives, bystanders, everybody. This we tap that potential of that huge crowd, and we talk to them about prevention of stroke, the golden window period of stroke, where to reach, the first aid for epilepsy not being a stigma, and epilepsy can be controlled, medications to be taken. And then we treat, then we do a huge, yes, and everybody, we all spread out across the place. And then we check on the screening parameters, the hypertension, diabetes, height, weight, everything, and we take the proforma, and then they enter the bus, that is my clinic, the wheels, where again I check them out and give the medications for a couple of them who are stroke patients, and then channelize them to the nearest PHC, so that these are the lifelong medications and you should not be missing them. So it's a comprehensive sort of package that we go in and move that, and it's very close to my heart as well.
I can see that.
Yes, it's very close. And Kathy, I really feel very happy when I visit those villages, and I should say the warmth of the villagers are also, so they take us so lovingly and understand and imbibe by that. So it's a good teamwork, Yes.
I personally think, Dr. Bindu, that doctors' profession is the most noble and give and take profession, because you can really serve people if you want to, and there is a very godly relationship with the doctor the patient has, because they literally hand over themselves to you, and then they say that they have a faith that you will cure them. And if the doctor is, as you rightly said, is dedicated and having that reality check, he or she can definitely cure the person, because moral and mental support is what plays a vital role than the actual medicines. You're absolutely right. Somebody is asking me a question, doctor, that the persistent neck and back pain due to professional sitting postures, can it be a worry point after a certain time?
That's very true, and it's one of the most important aspects of health that is creeping in now, because the usage of any of these LED devices, that is light emitting devices, be a phone, be it be your iPad, be it be your laptop or computer, you're constantly in a particular position, and that does give a long-term pain syndrome. Now, whether it becomes disease is difficult to say, because if you are in a particular position for a long period of time, you can have disc problems as well. If you are not exercising to the same extent as you are sitting, if you're exercising, you're going to the gym, you're walking, or you're dancing, or whatever form of aerobic activity that you're doing, that means you're agile. Secondly, you should be taking care, even if you feel that your computer or laptop or whatever it is, the ergonomics of the work should be proper. Your sitting should be proper, your chair should be proper, and your distance from the laptop and to the eye should be proper, so that you do not have to bend your neck for it. The head is a structure again, which is, the neck carries it for the whole day. Yeah, and it is unsupported, and I personally feel it is very cruel to the neck to have your head be supported for such empty hours. So you need to know that once if a muscle is unsupported and you're not giving it a rest for a prolonged period of time, definitely it is going to fatigue. And that fatigue is definitely going to give you a pain across the neck and to the shoulder, like a coat hanger, the hanger, how it is. Yes. And that fatigue can lead to headaches, that can lead to your work productivity becoming less, your concentration ability being less. And then, as said, that it can lead to long-term bad postures, can lead to disc problems as well.
Okay, now I have a question related to this, doctor. There are very common scenarios wherein, as you rightly said, we are not resting the neck, and then it is causing some sort of unpleasant, like blurriness, stiffness, giddiness, numbness, in number of symptoms. Some doctors do prescribe the collar, and there is a huge debate over here. Some say it is of no use, some say it is must. What would you tell?
Now, let me tell you what is the purpose of a collar. So you are not able to support the neck as effectively. So when you are not able to support the neck effectively, you are giving a band, so that, let us say if the collar is here like this, you are trying to ease the neck muscle so that the head just falls on the neck collar. So you are giving a relief to the neck muscles. It is just a relief. So most of the times I have seen patients wear the neck collar and then they are strained like this. So the purpose is not solved. The purpose is to just leave the head onto the neck, onto the collar, sorry. So that, your neck muscles, as I said, it is unsupported for the whole day. It is in a strain. So if you have severe muscle spasms, sometimes you have a severe disc where it is just not possible for the person to support his neck effectively, as one can't be on a bed rest, so you have to be sitting. That is the time when you need a neck collar. And you need to leave that head onto the collar. Otherwise, it doesn't serve. Otherwise, you are, as it is, your neck was in strain, you are carrying one collar also along with you. So it depends upon each patient, I would say. It is just not that you have a neck pain and then you get a collar. There is a difference there.
Okay. So it's not a generic...
No, it is not general for everybody. It will depend upon how the patient's severity of the condition is, his work profile, and how one can sort of remodel his whole treatment plan so that we can shorten the medication so that his neck is at ease. In severe cases, once he's got a lumbar, is a cervical disc surgeries, Sometimes even then they are not able to support. So that time also it is given so that he can, this will help to ease the neck muscles and it is not strained.
Um, we are coming back to the original problem that, in Indian context, stress and tensions is a very common issue that every Indian or every human being is going through. Now, that leads to many complications, as you mentioned in the beginning, the sugar shooting up, the BP fluctuating, the hypertension, and that leads to the neurological problem, as you rightly said. Um, how much your counseling and how much your medical treatment is available? The core problem is still as it is. So, do we need more of a moral counseling than the medical counseling?
Ketiki, stress is something which is probably just not possible for any individual to run away from. And it is universal, and it is across both genders, and it is across all ages now.
Absolutely.
At some point of time, it was only, I would say, in particular age groups, it was there. Now, even with the young kids,
Also, yes.
yeah, because of the peer pressure, school pressures, it's become very common now. Now, counseling, there are types of stresses, Ketike. Again, there is a short-term stress, there's an exam, there is a function, there is some issue at home. There's a short-term stresses, and it really doesn't have a bearing on somebody's health that much. If it is too big, then it can definitely, but then it is short lasting, and then usually people come out of it. What we are worried about is a chronic stress, which the people are not able to come out of. One is an exogenous and an endogenous. Exogenous is, we know the cause. Some etiologies and cause of stress cannot be rectified. Some can be rectified. Endogenous is, some of the stresses are, most of the time people are saying, I do not have any reason for stress, but I am stressed. We hear it very commonly in our outpatient clinics. The doctor usually tries to tell them that either you're not identifying the stress, you're trying to run away from the situation, and you're trying to say that, no, I'm blinding to myself towards it. It's like Billy doodh piti hai to aankh band kar leti hai. So you're trying to, no, try to identify it. There must be some issue which is bearing on you, but you're trying to run away from it because you're not finding a solution, and you feel that running away might give me a solution. Second is, there really may not be anything very great, It's just it's stress because of the robotic lifestyle that you're leading, getting up, working, and it's like timed, and there is no entertainment in your life. If you do not have entertainment, then your good chemicals are not there in your body. And after a period of time, your bad chemicals overpower you, and then you are in a constant state of stress. You need to revamp your lifestyle. Just go back to the original days where we used to socialize, mingle, talk, move out, have picnics, games, everything and anything that gives you pleasure, even if it is for 15 to 20 minutes, will move you out. Remove your stress. That word is very difficult. I would say that engage yourself in an activity where that stress does not play a part in your 24 hours. You keep your life busy in things which gives you more pleasure, which gives you more happy, and then those things become less significant for you. One is not able to control, then definitely needs a counseling, and it needs to meet a psychiatrist. And one should not be shy that I have to meet a counselor or I have to meet a psychiatrist to get counseling. No, everybody faces this. Someone is able to tackle, someone is not able to tackle. If you're not able to tackle, get a professional help and tackle it as fast as possible. Otherwise, it becomes a big issue.
More difficult, absolutely. Doctor, through this, your neurology on wheels, now that you said that you have a three-mold, working style also. So I also know that you're working with some local help as well. So because the reason I'm asking is, since it needs a constant follow-up and a long-term dealing, because you can't sit there every day. You go occasionally, and then you also want to cover as much as possible area. So, who are your support system, and how effectively is that working?
Now, I would say that the family is your first support system. My parents have been absolutely wonderful and have been a guiding force for me. Why? Because I would say that I just go out on a Sunday. So you are compromising. The first thing that any doctor who moves out of their comfort zone and goes out is their time and the time with the family that they spend. They have been very good, and initially they used to come along with me and be a part of it. So big life support, my parents, my support, my daughter. And then I have a team of volunteers who move around with me, and great kudos to them. And my heart always warms out to them, because I might come out with ideas, but they are also gelling with me with my ideas. And there are a group of people in the foundation who are youngsters, who are also sacrificing the Sunday on particular, not all Sundays, but particular Sundays in rotation, I should say. And they travel with me on my Neurology on Wheels. And some of the nursing staff from some nursing colleges, yes. So there are some couple of students, again, wonderful girls. They're almost like they're what do you call, the cheerful ones who bring in charm into the
Yes,
yes.
very
So
essential.
the whole team, I should say, is we are a happy lot. I should also say that we reach, we teach, we treat, and we also spread happiness along with that, because that's absolutely most important. And a big thank you, Ketiki, from in this media platform also. I should thank all of them who have been a part of journey at every point of time, in a small and a large way.
Absolutely. I echo your point, and I personally, me and my team also want to say thanks to them, because somewhere they are sacrificing their happiness, their free time, and doing something for the society. So, big thanks to all of them from our side as well. Doctor, last question. Whatever is the situation, whatever the reasons, but yeah, people do face brain hemorrhage and stroke kind of extreme situations. Medication is one part of it, but the mental stress and the trauma that not only the families but the caretakers go through is really not as effectively handled as the western countries have. So what is that you think we should do as a society? Because today we are very proud that we have a lot of youngsters, but down the line in 10 or 15 years, we will have a good lot of 60 plus crowd as well, and that needs care. So, what is that we should do as a society?
Very good question, because we do look into the caregiver burden as well. And actually, in fact, we have a study which has been published in a journal where we found that the caregiver burden was so high, and the majority of the large percentage, more than 3/4 of the caregivers were women.
Yes.
Yes, so that becomes a big burden for them. So I would put it this way, Ketiki, that if the caregiver burden has to come down, then the caregiver has to identify the health issue, and they have to bring the patient to the hospital immediately. If the burden is not there, the caregiver burden is not there. So we as doctors, we are not saying that we can cure each and every disease, but we can try our utmost to see that the burden of the disease can be minimized if we have the patient effectively in time. Sometimes, given what we may not be able to do anything. That's a different scenario. Otherwise, in that context, Ketke, actually we have started a new program from the foundation, that is EduVand, educating women about neurological diseases. So our target are women, because we feel that they are the first responders at home. So they should know about the stroke, and stroke is something which is time-sensitive disease. The patient is brought to the hospital within a golden window period of 3.5 to 4.5 hours. There is a thrombolytic therapy, that is a clot-busting therapy, that can be given to some patients, not all, and that can be, let us say, for around 30 to 40% patients can be independent at 3 to 6 months in their life. And that's a big number that we are seeing. So we teach them the symptoms of stroke. We teach them also how to prevent stroke, like hypertension, why you get diabetes, how to control, exercises, stress, body weight, BMI, and the requirement of salt. So another, Ketki, if any of your viewers want, as women organization, if they want to have a Zoom with us, we are ready to get into that as well. And we teach them the symptoms of stroke. So we have a Telugu mnemonic in our language, which I, from the foundation, designed in Sare Gama Pada Nisa, but for the general public in BEFAST. B is for balance, sudden onset of symptoms of balance. E is for eye, that is double vision, blurring of vision, blindness, or unable to see half of the environment. Then F is if we have two nasolabial folds. When we smile and talk, they're equal. If suddenly the person's face goes to one side, yes. A is for arm, that is hand and leg if they are weak, or hand and leg if they are numb, including the face. Then S is for speech. The speech is slurred, or the speech completely stops, or the patient starts blabbering, and which is not very legible for us to understand. And T is time. Time is brain. Every second that the patient is delayed to the hospital, every second, millions of cells are dying, and which are irreversible, and we cannot do anything for it. So once he comes to the hospital, he or she comes to the hospital, there is another, we need from door to needle time. Like we also need to take everything into account, his other comorbidities, get the scan done, get the lab pictures, talk to the relatives, thrombolytic therapy. There are side effects of this therapy, whether he's eligible or not. So we need time. In that context, we want that the caregivers should be strong, recognize the symptoms, get to the hospital, understand that diseases are as long as we can help the patient, whatever is possible, we will try to. All may not succeed, but then over a period of time, we have seen patients who are bedridden. Over the period of time, they have understood, they have taken, the caregiver have been the bound and support, physiotherapy, language therapy, moving him out, giving them positive support. They have inched forward, they have inched forward. So we rely a lot on the family to it's a journey. We and them are a journey. So caregiver stress is imperative. So I personally feel the burden should be less, so that their burden is less. Otherwise, in an Indian scenario.
Doctor, sorry to interrupt you, but since personally I have gone through it, I tell you, it's a very guilt feel for the patient as well. And
yes,
that really has to be addressed.
Yes. So every time when the patients come to the hospital, I engage all the relatives and I tell them that let the burden not be on one individual. Let one individual be like a monitor, but the other people also chip in their time whenever they come to the house. Let them not just come talk. Let them dedicate their time as well as, and measurable activity towards the patient. Not just talking. It may be some mental support. It may be some physical, taking the patient out of the bed, moving, taking him out. Some sort of shared responsibilities definitely has to be there. Otherwise, after a period of time, we see that the patient is better, or probably not better. This caregiver is definitely going down, and that's
but doctor,
not.
I tell you something. Here is a catch. Nowadays in India, most of the families are nuclear families, and that having that support is really vital. So I would also add the point, and you please educate us. Commercial help can be introduced at early stage. Do not wait till the very difficult situation, and then as you say, that can be a support to the caregiver. May not be directly to the patient, but here in India, since it's a human relationship, it's very crucial and very difficult to get that dedicated and sincere service. So I think that needs to be really looked into.
That's a absolutely valid and good point. We also suggest that try to take a help
service,
any help. And I personally feel when we are taking a help, the caregiver can take the big share of the personal attachment and the personal care. The manual work which needs to be done can be taken by somebody else, so that you're not physically very fatigued, but then you have got help where you have some time to rest. You have a time where you can relax back and have a cup of tea. You can just consolidate what you have to do in the whole day rather than just running around in the whole day and not really knowing
Panicky
what to
and
do.
stressed and
Yes, panic and anxiety and insomnia, everything.
yes,
You
yes.
can also sit back, okay, I am today going to do all this to my patient. This XYZ gentleman or girl is going to help me with all of this. And I think that needs a little bit of planning where one needs to sit down and consolidate things. And that is one big option which can have, but not entirely putting
Everyone
the
can
whole
do. Yeah,
everything on their hands. A personal touch of the caregiver we have seen always works, always works.
definitely it does. So thank you so much for your time, doctor. And I have not got into the lot of medical nitty-gritty as of now. So maybe we'll have a very technical round of discussion sometime as per your availability. But thank you so much once again, and all the best for all your wonderful philanthropic activities that you are doing. Individually, I would like to get attached with you. Do let me know. We'll talk about it sometime later.
Thank you so much, Ketaki. Thank you so much for having me on the show. Namaste.
God bless. Namaste.